Yes. Okay. Well, thank you then for coming out. I'm very glad to be here and grateful to be invited. Checking in with myself. My heart is heavy. 100 people were killed today trying to get some food. They were hungry. They rushed towards the trucks where the food was. They got massacred. I don't care how you feel about that politically. You can have all kinds of views about history, but this is humanity at its worst. What we do to each other. And if the teachings of the great pioneers in spirituality and trauma and health and healing mean anything at all, then we all live in the same world. And we're all affected by everything that happens. And we can't split ourselves. And we can't split our hearts. So that's with me right now. The topic I've been asked to address today was embodied approaches to healing trauma. I've never had a training in any of the things that I'm talking about, which is probably maybe a good thing. It's a bad thing. I don't know. But let me tell you a couple of psychiatric horror stories, okay? One has to do with San Diego. Now, how many of you have heard about I hope to God everybody puts their hand up, but just be honest about it. How many of you have heard about the adverse childhood experiences studies, the ACE studies, okay? Not good enough. The adverse childhood experiences studies are very famous studies published in major medical journals, psychological journals. And it provided the statistical and correlational proof of what the pioneers of trauma like Peter Levine and Bessel, van der Kolk, and other people have been talking about for decades. And these studies were initiated here in San Diego. They're called the Adverse Childhood Experiences Studies, ACE studies. You can look them up online, the ACE studies, again, published in multiple formats, and they've been repeated, and the results are always the same. Basically, they looked at childhood experiences such as physical, sexual, or emotional abuse, a parent dying, a parent being addicted, a parent being mentally ill, a parent being jailed, violence in the family, neglect, a divorce. And for each of these adverse childhood experiences, the risk of addiction goes up exponentially. So by the time a male child has six of them, his risk of becoming a substance injecting drug addict was 4,600% greater than that of a child with no such experiences, a 46-fold increase. The risk of mental illness goes up. Dr. Richard Bentall, who's a British psychologist, a member of the British Academy, has said a few years ago that the link between childhood adversity and adult mental health problems is as well established statistically as the link between smoking and lung cancer. And these ACE studies, they didn't show the causation, the causative link. The causative link between childhood trauma and adult health challenges has been shown in multiple other studies, and of course the trauma work of Peter and Bessel and many others. but they're the ones who showed the statistical link. Now, very famous studies published again all over the world. Here's the horror story, okay? First of all, the studies were initiated here in San Diego. There's a wonderful physician, now retired, that used to work for Kaiser Permanente, Dr. Vince Felitti. How many of you know his work? Dr. Vincent Felitti. He's the lead author of these studies, and he was working here at an obesity clinic where they found that with rigorous dietary control and exercise regimen, they could get people to lose weight. What do you suppose they couldn't do? They couldn't help them keep it off. And Vince was a wonderful man, did something extraordinary for a medical doctor. He actually listened to his patients. And he says, what's going on here? And they said, don't you realize we're stuffing our pain down? They'd all been traumatized. Which immediately brings up one of the points of my talk. And I don't know why or who's texting me right now. Okay. Is that I forgot the point because I got the text there. Sorry? Stuffing the pain. Yeah. Yeah. Which is that Western medicine and much of Western psychology looks at people as individual, separate entities. But if people are eating to stuff their pain down, that's a very different proposition than saying that they lack self-discipline or that they're weak-willed. The one is a judgment, the other is an explanation. But if it's an explanation, if somebody has pain, that's a social phenomenon. Pain is incurred in relationship. And therefore, if there's an obesity epidemic in much of the world now, we can put it down to three factors, which is what Western medicine basically, three factors. One of them is genetics, which is the usual go-to of the uneducated, which means much of medicine. Or you can put it down to individual choices and bad decisions, which is the main perspective of this society. We tend to punish people for so-called choices that they made, like using drugs or sleeping in the street. Ronald Reagan famously said that homelessness is kind of a choice, isn't it? As he said that. Or we can say something happened, and this something that happened in relationship, because you cannot separate the mind from the body, and you cannot separate the individual from the environment. Now, that third one is the perspective that I'll be putting forward, and I'm sure many other speakers here at this conference will also express. And it's also the only scientific point of view. It's also the one that's least popular. So Vince Felitti, because of his experience at this clinic, he said, well, let's look at this in a larger sense. So they looked at 17,000 people here in California, and they looked at 50% of them were university educated, 80% were Caucasians. And they looked at childhood experiences and adult behaviors or adult problems, and they found these correlations between childhood adversity, adult mental health, and autoimmune disease, and behavior problems, and mental health problems, addictions, and all this stuff. I'll tell you two stories related to the ACE studies. One is, this study was done under the aegis of Kaiser Permanente, a big healthcare provider here in California. "15 years ago, or maybe 12 years ago, after my book on addiction came out, in which I argued that addiction is not a disease that's inherited, nor is it a bad choice, but it's a trauma response, I got an invitation from Kaiser Permanente here in California, in Sacramento. to go and speak to their clinicians about addictions and trauma. I said, great, I'm happy to come. But a month before the conference, they sent me an email saying, well, could you possibly send some, do you know any studies that would back up your argument? I said, yes, Kaiser Permanente, the organization that's inviting me. These studies were done in your institution. They said, really? No kidding, they hadn't heard about it. That's the first psychiatric horror story. The second one is 6 years ago, I was at and the reason I'm telling you the stories is to tell you what you're up against in this society. When you talk about trauma, what you're up against is the intense denial and almost willful ignorance. So I was at a conference on addiction in Norway, maybe 7 years ago, no, 6 years ago. And there were two other speakers. One of them is a leading American psychiatrist. He edited one of the editions of the DSM. If I mentioned his name, you'd know it. The other was a person very high up in the CBT, cognitive behavioral therapy world, as high up as you can get. You would know the name if I mentioned it. We had dinner the night before the conference, and I asked the psychiatrist, where do you live? He said, oh, I live in San Diego. I said, oh, you must know Vince Felitti. No, he says, who's that? I said, oh, he's the leading, I said, I was getting excited. I said, well, he's the lead investigator of the very famous adverse childhood experiences studies. They both said, what are those? They'd only been published in the Journal of the American Medical Association, and on. That's how deep the ignorance is. Now, the other psychiatric horror story I'll tell you is when I was a medical student, I was in fourth year, and I was on my psychiatric rotation, and they assigned me as a primary therapist to an inpatient who came in because of suicidal behavior. How they appointed me to be his primary therapist, not having had a second's training in anything. But anyway, that's how the system works. So I was sitting with the guy. We're in a room. I'm sitting on a chair, and he's sitting over here in another chair. And there's a mirror on the wall, and the mirror is a one-way mirror where we see a mirror, but behind the mirror, there's a see-through glass where the psychiatrist and his residents can observe me interacting with this client. And at some point, the man says something. So I'm sitting there like this, and he's sitting there, and he says something, and I reach out and touched his knee, and I said, huh, why did you say that? No, what do you think the feedback was afterwards? You think the feedback was I shouldn't touch him, right? That's not the horror story. The horror story is the psychiatrist and his resident said, my God, that was brilliant. How did you know how to do that? Where did you learn that technique? In other words, I was being a human being, reaching out to touch somebody who was in evident emotional pain, and they said, that's brilliant. I got the class prize in psychiatry, $100. What am I talking about here? I'm talking about the split between actual human experience and actual lived reality and much of the healing profession, which is what makes this kind of a conference all the more important. Now, I'm going to read you a quote. Of course, Bessel's famous line is, in the title of his book, The Body Keeps the Score. Some years before then, Alice Miller, now how many of you know her work? Now, she's an interesting case too, Alice Miller, a great Jewish, Polish, Swiss, German psychotherapist who did seminal work on childhood abuse and its impacts. And she's the one that woke up much of the many people to the impact of childhood experience in books like For Our Own Good and The Drama of the Gifted Child and other books like that. And for me, she was a seminal teacher. I knew about her before I knew about Levine and Van der Kolk and the others. And she wrote, the truth about our childhood is stored up in our body, and although we can repress it, we can never alter it. Our intellect can be deceived. Think about that one. Because we live in a society that's so in awe of the intellect. But who here hasn't had the experience of believing something on a cognitive level, but there's a conflict between what your heart is telling you or what your guts are telling you? The intellect can be deceived. The intellect is on its own, disconnected from the body, disconnected from the gut, disconnected from the heart, is a very dangerous entity. Can be very dangerous. You can use the intellect to work at how to help and transform and heal people's lives. We can use the intellect to design gas ovens to kill people. That's what the intellect on its own is capable of. Anyway, our intellect can be deceived, our feelings manipulated, our perceptions confused, and our body tricked with medication. But someday the body will present its bill, for it is as incorruptible as a child who, still whole in spirit, will accept no compromises or excuses, and it will not stop tormenting us until we stop evading the truth. And in my book, The Myth of Normal, the most recent book, there's a chapter called Disease as Teacher. And I used to work in palliative care. I worked in family practice, looking after, families from babies, pregnant women to people at the extremes of old age. And it was very clear that people's illnesses didn't come out of the sky. They weren't causeless. There's a favorite word in medicine that we call idiopathic. Idiopathic, we don't know the cause of it. So Western medicine, for the most part, will say that autoimmune illnesses where the immune system attacks the body, like multiple sclerosis or rheumatoid arthritis, scleroderma, lupus, these are idiopathic. We don't know what causes them. What was interesting to me, and same thing, or a lot of cancers, What was interesting to me is that when I saw who got sick and who didn't, it wasn't accidental. There were certain patterns to people's lives that developed illnesses. I'll say something about them perhaps in a minute. But the point is that the diseases weren't just random misfortunes. And I've talked to a lot of people. In fact, let me ask you, how many of you had the experience of having an illness that you wouldn't want to wish on yourself or anybody else, but having confronted the illness, you learned something very valuable about yourself? Just put your hand up if this happened to you. That's quite a few, isn't it? And you'd never wish disease on anybody, but boy, it can wake you up and teach you. It can wake you up and teach you. So in The Myth of Normal, there's a chapter called Disease as Teacher. Now, what did people find out when they got sick? Well, I'll cut to the chase. There was a book written about 12 years ago by an Australian palliative care nurse She worked with dying people like I had for 7 years. I was the director of the palliative care unit at the big hospital in Vancouver. And boy, do you find out about people's lives when they're dying, because they open up. If you listen to the dying, you'll learn a lot. And she wrote this book called The Top 5 Regrets of Dying People. And you know what the top regret was? That they weren't true to themselves. They weren't authentic. That they suppressed themselves for the sake of being accepted by others. That was the biggest regret. I'm not talking about people dying at the end of a long and satisfying life. I'm talking about people who are dying of diseases, particularly malignancy, long before their time. That was the biggest regret. Another big regret on the top 5 was they didn't express their feelings. What do you think, what does that have to do with illness? Let me tell you what it has to do with illness. There was a study done in Massachusetts a few years ago, well, some years ago now. They looked at 2,000 women over a 12-year period, sorry, a 10-year period, and they found that of those women, those who were unhappily married and didn't express their feelings were 4 times as likely to die as those who were unhappily married but did talk about their feelings. So for the guys in the room, the next time you complain that your wife complains too much, be happy about it, you know? And if you look at the personalities of individuals who develop autoimmune disease and the malignancy, there are certain traits. And these traits are embodied. They're not just sort of abstract psychological qualities. Number one, they tend to be people who are pleasers, who tend to look after the emotional needs of others rather than their own. This compulsive need to look after others while ignoring your own needs is a risk factor for illness, number one. Number two, a compulsive and rigid identification with duty, role, and responsibility. So that, again, what we're talking about here in both of these cases is what Peter talks about in terms of the essence of trauma, which is a disconnect from the self, disconnect from the body. No infant is born disconnected from the body. No healthy infant is disconnected from the body. Therefore, for you to get disconnected, so you're not even aware of your feelings, or you think somebody else's feelings are more important than yours, chronically and compulsively, something has to have happened. Something has to have happened. Some disconnect must have occurred. So that's the first two. The third one is the repression of healthy anger. These are, I always worry about the very nice people who are so nice that they never get angry. Because anger, we're wired for anger. Do you know that? There's a circuitry in our brain for anger. And there's a good reason for it. Not just we, mammals are, other animals are. Anger is a boundary defense. If you enter my space, I better get angry. Get out, this is my space. That'll save me, it'll save you, it'll save both of us from having to fight. You've never seen a baby with repressed anger. Try feeding them something they don't want to eat. You'll find out. Ignore their cries, you'll find out. Incidentally, one of the insanities of our culture is that we train parents not to pick up their kids when they're crying. It's toxic. So repression of healthy anger. So anger is a boundary defense. It turns out on the body level, and those of you that are therapists and you work with anger, you'll know what I mean here. But on a body level, the repression of anger isn't just sort of an abstract, disembodied dynamic. Think about yourself. Think about when you've been angry, really angry about something, some boundary invasion, perhaps. What's in your body? Is it just sort of a non-felt, neutral experience that you're having? Or is there tension? Is your heart not racing? Isn't there a tightness that wants to explode out of you? Well, what happens to it in people that repress anger? You think it goes away? Think of all the energy it must take to repress all that anger. It's like trying to keep a big balloon underwater. And the repression of anger on the body level actually represses the immune system. That's been shown in the laboratory. And when you think about it, it makes perfect sense. Because if anger is a boundary defense, and if the role of emotions in general is to let in what's healthy and welcome and nurturing and loving, which is what emotions do, come here, or keep out what's toxic and dangerous and unwelcome, that's the role of the emotions, isn't it? It's a boundary. Emotion is a boundary that let in things that are welcome and nurturing and keep things out that are dangerous and hostile or toxic. Trick question, deep one, think about it. What's the role of the immune system? Same damn thing. To keep out what is unhealthy, viruses, toxins, unhealthy bacteria, let in what is nurturing, healthy bacteria in your gut. The microbiome, for example, there's billions, trillions of bacteria living in our guts, thank God. Nutriments and so on. So the emotional system and the immune system have exactly the same function. And here's the news that they still don't teach in medical schools, even though it's not controversial scientifically. All these systems are embodied. They're part of the body, and they're not separate systems. It's not that there's an emotional system over there and an immune system over here. If they're the same system, as is the hormonal apparatus, as is the nervous system. This again is just pure science. So naturally, when things happen emotionally, of course they'll be embodied. Of course the body keeps the score. Of course, as Alice Miller says, that the body will at some point presents the bill for all that repression, and that bill is the illness. And when people get sick, some of them wake up. More of them would wake up if physicians understood this very simple dynamic. Now, as to why people suppress themselves, are you saying you're blaming people for being sick? By the way, this is not just my own observation. These characteristics of chronically ill people, they've been studied all over the place. It's always the same findings. Self-repression is the key dynamic. Now, why would people repress themselves? And here's where you get into the problem of this whole society. I mentioned the tragedy in Gaza this morning. Now, what do you think would invite a larger TV audience? A discussion of how that thing became possible? What were the factors? What's the history? How to understand that conflict? Or if Taylor Swift and Travis Kelce showed up on Oprah, what do you think would draw the bigger audience in this country? Or the fact that unless you're totally blind and deaf or work for an oil company, you know that the climate is changing, not to our benefit. People are already losing their homes and their lands because of it. People are falling sick in the millions because of it. Well, what do you think would draw the bigger audience? An analysis of the last quarter of the Super Bowl, or a discussion about what the heck we could do about this thing that threatens all of us? But what are we talking about here? We're talking about a total disconnect on the social level. And that same disconnect, I'm not criticizing anybody, by the way, I'm just describing how it is. So the disconnect from the body that Peter talks about so eloquently as being one of the essences of the basic dynamics in trauma is manifested on the social level as well, with the same kind of disconnect. And the one reinforces the other. Now, why would somebody repress their emotions? Very simple. The child, and I often talk about this, the child has some fundamental needs. One of them is for attachment. In fact, the basic one is for attachment. Attachment meaning literally to attach to somebody so that you can be cared for and nurtured and protected and mentored and guided and held. That's a powerful dynamic that our brains are wired for. But we have another need that I've been kind of talking about, which is what we can call authenticity. And authenticity, I don't mean the new age, whatever idealistic vision somebody might have of authenticity. This society markets everything. It even markets authenticity. Coke is the real thing. The real thing is Coke. Get it? Coke is reality. It markets reality, authenticity. But let me ask you this question, a body-related question. How many of you had the experience of having a strong gut feeling about something, ignoring it, and then being sorry afterwards? Just raise your hand. Yeah, a vast majority of us. That's how important gut feelings are. Now, we evolved out there in nature for millions of years until a few thousand years ago, 12, 15,000 years ago, we all lived out in nature. And much longer for many people. How long does any creature in nature survive if they're not connected to their gut feelings, if they don't listen to them? That's what authenticity is, being connected to your feelings and being able to express them and manifest them, which incidentally is one of the needs of children, to be able to embody and experience all their emotions, fear, grief, sadness, anger, joy, curiosity, all that. So we have this need for attachment, and we have a need for authenticity. All right. So far, so good. But what happens if the two needs should collide? And why do they collide? Because of the way we parent kids in this society. A lot of kids grow up getting the message that if you get angry, you get a timeout. Which means that I'm going to threaten you with the biggest possible fear, which is the loss of the attachment relationship. Or in a family where a parent is an alcoholic, or parents are emotionally troubled or stressed, as many parents are in a society, not their fault, it's the nature of the culture. A child will very often suppress their own feelings in order not to disturb the family peace. So the dynamic or the dilemma of, shall I be authentic and possibly lose my attachment relationship, or should I give up my authenticity in order to belong, is always decided in favor of attachment. The child can't help it. That's just the way it goes. So then you get to the point where you have a gut feeling, you won't listen to it Because you learn that if you do, there's a price to be paid. And the people who are really in trouble are the ones that don't even feel their gut feelings anymore. They go into politics. But that's another issue. So that this disconnection from ourselves, and this is the essence of, I think, what a lot of us teach, is that these dysfunctions, including the disconnection from ourselves, even though it has multiple negative consequences, it wasn't some kind of a mistake. It was a necessary outcome of traumatic experiences. And trauma doesn't have to be overt and horrible. Trauma simply means wound. And people can be wounded in a whole lot of ways, particularly young, sensitive kids can be wounded without being abused, without being neglected, without watching terrible things, just by not having their needs met, for being attuned to, being understood, being seen, being heard, being picked up when they're crying, being validated when they have an emotion, being made to work, to make the relationship with the parents work. All that can wound kids. And then that wounding takes the place of all kinds of disconnections from the body that you'll hear about this whole weekend. Let me say a few words about, so I'm not going to lay out for you all the pathways that this repression leads to physical illness, but I've written about it in a number of my books, When the Body Says No and in The Myth of Normal. Mental illness. Again, we have two major views of it in this society. One is just, people are just something wrong with them. You know, what's wrong with you? What's wrong with you? As the brilliant book by Bruce Perry that he wrote at Oprah. That's not the question. The question is, what happened to you? Now, I have a friend who's an American physician, psychiatrist, and he's part Lakota, Sioux. And he told me that his name is Louis Malmadrona. And Louis told me that in the Lakota tradition, when somebody gets sick, the community says, "Oh, thank you. You're manifesting some imbalance, some dysfunction, something amiss in the community. Your illness represents something that we needed to know about in our community. So your healing is our healing." That's the indigenous tradition. Not only is it beautiful and emotionally and spiritually satisfying, it's also scientifically true that people's illnesses of mind or body represent communal, interrelational dynamics. In the United States, Black infants have a much higher chance of dying during childbirth. But get this, if the delivering physician is Black, the risk goes way down. And not because of any overt racism on the part of the white physicians, but there's something culturally there that's affecting that child. In the United States, if you look at the chromosomes of people of color or other visible minorities, the chromosomes are more aged, they're more older than their chronological age compared to Caucasians. And this doesn't have to do with economic status purely, because it's the same for people of same economic status, different color. It's not genetic. It's a result of racism. An American Black woman, the more experiences of racism she has to endure, the greater her risk for asthma. Now, asthma is an embodied manifestation of stress, is what it is. We treat asthma with stress hormones, cortisol and adrenaline. That's what we give to asthmatics. Children whose parents are stressed are much more likely to have asthma. We've known this for decades in all kinds of studies. In other words, the embodied manifestation of illness, the inflammation of the airways and the narrowing of the airways is actually a social phenomenon. It didn't just happen in a single organ in some isolated body. And that repression of emotion, for example, was a coping mechanism. So when you work with people, when I work with people, and my method is called compassionate inquiry, but it's the same with any therapy where it's solved. You don't make people's dynamics wrong. You say, what purpose did they serve? Well, let me give you an example. Addiction. So I worked in Vancouver's downtown east side. Vancouver, British Columbia has a area called the downtown east side. It's North America's and the Western world's by far most concentrated area of drug use. We have more users there in a few square block radius than anywhere else in North America. Injecting, inhaling, ingesting substances of all kinds. I worked on there for 12 years. In relationship to the ACE studies, in those 12 years, I didn't have a single patient, a single female patient, who had not been sexually abused as a child. But let's come back to this coping mechanism idea. So I'm going to give you a definition of addiction. I want you to think about it personally. Addiction is manifested in any behavior in which a person finds temporary relief, pleasure, and therefore craves, but then suffers negative consequences and is unable to give up despite those negative consequences. So pleasure, craving, relief in the short term, harm in the long term, inability to give it up. I said any behavior, I didn't say drugs. It could be drugs, of course. Nicotine, caffeine, alcohol, the illicit drugs, opiates, whatever. Could also be sex, gambling, pornography, shopping, eating, internet, cell phones, work, extreme sports, bulimia, almost anything you care to name. So pleasure, craving, relief in the short term, harm, inability to give it up in the long term. So let me ask you this question here. According to that definition, how many of you at some time or another in your life did have some kind of an addictive pattern? Just raise your hand. Okay, great. Well, 2 or 3 liars, but most of you are pretty. No. No, for those of you in the front, so I can hear you, because I'm poor hearing. Don't tell me what you're addicted to or when or for how long. Just tell me, what did it give you in the short term that you liked? Anybody? Sorry? Relief from pain. Thank you. A little relief of anxiety. Anybody else? Avoidance of avoidance of feelings. Okay. Now, why would somebody need to avoid their feelings? Because the feelings are painful. Okay. So basically, and whether you say it's because you want to have a sense of belonging, sense of control, basically addictions are a form of pain control. So my mantra on addiction is, don't ask why the addiction, ask why the pain. Now, is pain relief, stress relief, or these bad things or good things? They're good things. The addiction was not a disease that you inherited. It's pure nonsense. It wasn't a bad choice that you made either, because you didn't choose it. I've never met a single person who woke up and said, my ambition is to become a drug addict or a bulimic or whatever. Addiction is a coping mechanism for pain. Where did that pain come from? Trauma. It's a coping mechanism. Now, this is an example I often give. I've been diagnosed with 2 mental health conditions. Well, 3, if you ask my wife. There's also narcissism, but officially I've been diagnosed with 2. One is ADHD, that is depression. So I was in my mid-50s when I was diagnosed with ADD. I was self-diagnosed actually, but I went to see a psychiatrist and he agreed, or she agreed, actually. And I took medication for a while, helped me write my first book. Don't need it anymore, by the way, which means that the brain can actually change people. Yes, the brain can change, you know. And the medical mantra was, here's this inherited disease. It's the most heritable mental health illness. The heck it is. If you look at the hallmark of ADD, attention deficit disorder, that's the first book I wrote, Scattered Minds. The tuning out. What is it? We all have the capacity to tune out. When do we do it? If I were to stress you right now, distress you right now, your natural impulse would be, number 1, ask for help. That's the natural one. And there's 600 people in the room with you. You could ask for lots of help here. Or you could leave. Or you could fight back saying, you can't talk to me like that. You can't do that to me. So flight or fight or help seeking. But what if neither of those options are available to you? For example, what if you're a 1-year-old, like I was, as a Jewish infant under the Nazi occupation in Budapest? Or if you were the child of a family that's very stressed because of economic reasons, or racialized reasons, or war, or political turmoil, or because both parents are trying to make a living and they don't see you the whole day. So you're very stressed. You can't fight back, escape, or ask for help. From whom? You tune out. But when do you tune out? You tune out when your brain is developing. So not only is the psychological dynamic of tuning out a defense mechanism, it gets embodied. How does it get embodied? I'm just going to read you something very quickly here. This is, again, a big secret because I've only known this for 50 years. And it's only been published in all the major medical journals. That's why no doctor ever knows about it. So I'm going to read you from an article from the Journal of Pediatrics, which is the official journal of the American Pediatric Academy. The article is from a little-known fly-by-night institution called Harvard University, so why would anybody know about this? And this appeared 12 years ago now in February, and it's about the brain. And here's what they say. The architecture of the brain is constructed through an ongoing process that begins before birth, continues into adulthood, and establishes either a sturdy or a fragile foundation for all the health, learning, and behavior that follow. In other words, the brain develops from when you're still in the womb. If your mother's stressed, that's going to affect your brain. We know this from all kinds of studies. And it continues into adulthood. So all these experiences of childhood gets embodied in the brain. The interactions of genes and experiences literally shapes the circuitry of the developing brain and is critically influenced by the mutual responsiveness of adult-child relationships, particularly in the early childhood years, meaning that the most important influence on the physiology of the developing brain, which neurotransmitters, serotonin, dopamine, endorphins, oxytocin, vasopressin, whatever, and the receptors for them is determined by the quality of your emotional experiences in interaction with the parenting caregivers. So your earliest experiences get embodied and embrained, if you like to put it that way. So if your family is stressed and you're stressed or you tune out, That gets wired into your brain. And now they're going to tell you got this inherited genetic disease of the brain. No, you don't. What you've got is the problem of development. And that's where therapy comes in. Because if you look at mental health issues, and I'm only giving ADHD as an example, not as diseases, but as processes that arose in response to life experience, that it also follows, given that there is neuroplasticity, the brain can develop new circuits and new dynamics later on in life, then new experiences will grow different brains. And if you as the therapist can attune with the body and the brain and the mind and the soul of that person, that can trigger new experiences and new developments on the body level and on the brain level. But not if only you pay attention to symptoms. Not if your intention is simply to suppress symptoms or to change behaviors, cognitive behavior stuff. But that can be helpful in some situations, but it's not going to transform anybody because you're not dealing with the underlying dynamics. Not in my view. Depression. How can that be a coping mechanism? Well, what this article that I quoted you from Harvard said, that early adaptations can serve their function of getting the child through some difficult times, but then become sources of problems later on. And any therapy worth its salt will recognize that the dysfunctions, the dysfunctional behaviors, thought patterns, emotional dynamics, that relational difficulties that people come in with had their source in adaptations. So depression, let's just look at that word depression. What does it mean to depress something? It's an English word. It means to push something down. What gets pushed down in depression? Anger, emotions. Why do they get pushed down? I already talked about that. Because at some point you learn that you're safer to push down your feelings than to express them. People will even push down their joy if the parents are unhappy and they can't handle the child's exuberance. Children will even depress the experience of joy, never mind the experience of anger. It's a coping mechanism to make them belong and be accepted. Then you're told, oh, you got this genetic disease called depression. No, you don't. Well, can medications help? Sure, I've taken medication for depression, not for a long time, but they did help. I mean, not since a long time ago, but when I did, it helped me. Well, this proves that depression is biological. Of course it is. Everything is biological. But the biology is a product of the environment and the individual's interaction with the environment. So just because somebody gives me Prozac and my serotonin level comes up and I feel better, it doesn't prove that my depression was caused by a lack of serotonin. It's another big myth. I mean, if you go to a party and you're shy and you're kind of reticent and sitting in a corner and, and then you have a glass of gin and all of a sudden you become voluble and social in life of the party. Does that prove that your social backwardness was caused by a lack of gin in your brain? We got to be rational about these assumptions. So look, what I'm saying, and I'm going to come to a close now because I know we have lots of time for questions. Spoken for about an hour now. Whether we're looking at physical illness, whether we're looking at what we call mental illness, we're actually looking at processes. These processes are dynamic. They can change. They're a response to life experience. Given new experiences, new relational experiences, and especially new relational experiences that pay attention to the body, because after all, it's all embodied, we can actually transform and grow and change. I'm, I'm compelled to read you something that's quite astonishing. How many of you have seen a film called Zone of Interest? Nobody here. Maybe it hasn't shown here. The German film. It's about Auschwitz. Not actually about Auschwitz, but about the commandant of Auschwitz. His name was Rudolf Höss. He was hung after the war in Poland. He built the Auschwitz concentration camp with the gas ovens and the whole, or the gas chambers and the ovens and so on. So the movie's about him. And his family had a home right outside Auschwitz. He grew up, he brought up his kids just outside the wall of this concentration camp. That's how disconnected people can become. But it's not so strange. Anyway, I'd like to read you something. This is a father's letter to his son. He writes, keep your good heart. Become a person who lets himself be guided primarily by warmth and humanity. Learn to think and judge for yourself responsibly. Don't accept anything without criticism as absolutely true. The biggest mistake of my life was that I believed everything faithfully which came from the top, and I didn't dare to have the least bit of doubt about the truth of that which was presented to me. In all your undertakings, don't just let your mind speak, but listen above all to the voice in your heart. Wasn't that beautiful? That was written by Rudolf Höss, responsible for the deaths of millions of people. And he meant it. He had a transformation 4 days before he was hung. Why? Because the Poles, to whom he was handed over because he committed his crimes in Poland, treated him with kindness when he was in jail. He said it's the first time anybody ever treated him with compassion. He wasn't asking for clemency. He knew he was going to die. When he wrote this letter to his son, there was nothing in it for him. He was expressing his newfound connection to himself. Well, I'm suggesting if that kind of transformation is possible for somebody as monstrously distorted and disconnected from his humanity and from his heart as our Rudolf Höss, then surely it's possible for everybody, provided the right environment. And so I'm going to finish with my summary of compassion. The course I teach for therapists is called Compassionate Inquiry. But what do I mean by compassion? So there's 5 levels, and it doesn't matter. And my method isn't better than others. It's just what I happen to have developed. Lots of great therapies out there, and you'll be introduced to many of them this weekend. But the compassion part has to be universal to all of them. And what do I mean by compassion? So I distinguish 5 levels of compassion. Just think about it. I'll go into them quickly. 1, there's the ordinary human compassion. When I say ordinary, I'm not dismissing it. I'm just saying it's regular. It's what we expect. It means when somebody suffers, you feel bad. You just feel bad. We don't want to see other creatures suffer, human or animal. Number 1. Number 2, what I call the compassion of understanding. It's not enough to feel bad for people that they're suffering. You have to understand why they're suffering. That's where trauma comes in. You have to understand the trauma that they endured that drives those behaviors. That's what I call the compassion of understanding. Third one is what I call the compassion of recognition, which is very quickly, when I worked in the downtown east side with all those abject, street-dwelling, HIV-ridden human beings addicted to substances. There was nothing different about them that I didn't recognize in myself. I was quite capable of lying with my addictive behaviors as they were. manipulating, being compulsive about it, being controlled by it. Now, the differences between them and I were obvious. I've been a lot more fortunate in life. That was the big difference. But the dynamics were the same. So as long as you as the therapist don't sit there thinking that you're the expert on those poor, blithering, unfortunate to come to your office, Nah, everything you got, everything they got, you got. And the quicker you see that, and the more you work on yourself, the more effective you're going to be. The fourth compassion, I call it compassion of truth. We are often worried about causing people pain by our therapy. Well, that's true. Nobody should cause somebody pain by therapy. You can do it. You can cause people pain if you're inept, or if you're not compassionate, or if you're not self-aware. But you also mustn't be afraid of pain. The illnesses, the addictions, the depressions, the tuning out, the scattered minds, even the psychotic fantasies, these are all attempts to escape from pain. If you work with people, they're going to feel the pain. That's the compassion of truth. Their attempt not to feel the pain is why they're in your office in the first place. That's what led to the dysfunctional behaviors. We should not be afraid of pain that's there. That doesn't mean you induce it, cause it, or that you work with it in an unskilled way. Peter will talk to you about titration, so that you do this gently, but you sure mustn't be afraid of people's truth. And since the truth is painful, yeah, they're going to experience pain if you're doing your job. But they can experience it in a way that they didn't experience it in childhood, because in childhood, when they had the pain, there was nobody there to accompany them and to hold them and to support them and to understand them and to validate them. That's why they had to suppress it. And the fifth level of compassion is what I call the compassion of possibility, which is very simply seeing the potential. And I'll finish by quoting Peter Levine here, who in his upcoming autobiography, which I had the fortune to read, he says, we all have the capacity, the capability to heal. We all have the capability to heal. I believe that there exists in humans a fundamental primal drive towards wholeness and health. This includes access to a part of ourselves that has always been within, that lies beyond any trauma and is eternally whole and undamaged. It is the part that could be called the true self or the real self. And then he says that, and there's an instinctual curiosity, there's an instinctual drive towards that wholeness, towards that authenticity, what I call authenticity. He says, unfortunately, in this society, is too often is forced underground. But nevertheless, he says, this powerful resource lives deep within all of us and lies in wait, ready to be awakened at the right moment. That's our job. Thank you. Thank you. So there's less time for questions than I'd hope, but I'm happy to extend it a bit if that's okay with the organizers. How are we going to handle the questions? Do people go up to mics, or do they get mics taken to them? How does it work?
Yeah.
So, which way? Is there?
Can I start?
Okay.
Can I start over here?
So if you have a question,
Yeah, I have a question.
Yeah.
Given using your idiom that not every therapist is worth their salt, what advice would you give to somebody seeking a therapist worth their salt? Is there generalized advice? Like, for example, would you have an embodied experience? I know you're about compassion. So would you just sort of just trial and error? Would it depend on what you're trying to
Well, sorry, are you talking about how to find a therapist?
No, I don't mean so simplistic. Like, for example, like how would you, if you were a patient now,
Yeah,
how would you go about finding a therapist that was worth their salt?
okay.
Okay.
So,
And specifically also with rage to express, because not everyone can handle, we live in this society where, you know, where people have to fear expressing rage because true rage can sound like it could be grounds for, if it's, you know what I mean? You know what I'm asking?
well, no,
I'm sorry, I'm inarticulate about.
that's okay. Well,
Okay.
so first of all, there's a difference between rage and healthy anger. Okay?
Healthy anger is what I meant. Sorry.
Healthy anger is very simple. You're in my space, get out. And
Okay.
as soon as it's done its job, it's gone.
Okay.
Rage is different. Rage is like, and we talk about fits of rage.
Not acted on, just in terms of like more like
Okay. Rage, which is not a boundary defense.
not everyone can handle it, like, so how would you assess if a therapist can,
The first thing I would request is that you let me finish the sentence.
sorry.
That's okay.
Sorry.
I mean, I appreciate your question, but I gotta be able to.
I'm so sorry. Thank
No,
you.
no, don't apologize. Just shut up. Okay. Look,
Okay.
okay. So rage recruits more and more brain circuits in its service, and it's like an epileptic fit of rage, literally. So that's not what we're talking about here. Now, to go back to your question about therapists, first of all, I'd want them to be trauma informed. If they're not, I don't care how good they are. But let me backtrack. Actually, when you look at the studies on what makes for effective therapy, you know what it is? It's not the technique of the therapist. It's not their formal academic or other qualifications. It's the quality of the relationship between the client and the therapist. So, so if I actually, there was an interesting study that looked at the heart emits electrical waves, radiation, as does the brain. And when the waves are in sync between the heart and the brain, you're in a state of calmness and presence. Okay. So they looked at people in therapy with their therapist, and they're measuring the emanations, the radiations from the heart and the brain of the therapist and the client. The most effective moments of therapy was when the radiation of both therapist and client were in sync with each other. And you know what this happened? And this happened more often when the therapist was listening rather than when they were speaking. So it wasn't the great insights of the therapist that made the hugest difference. It was the capacity of the therapist to actually listen and be present, really be present with the client. That you can't read that on diploma. That you have to read body to body when you're sitting in the office. So the first thing I say to people is, look into for somebody, see how you feel with them. Really check in with yourself. What's in your body? How much calm is there in your body? How much warmth is there when you're with this person? That's the first thing. Now, on the level of training, I'd want that therapist to be trauma informed. If they're not looking at sources, they're only looking at effects. And number three, I'd want to know that this therapist does know how to work with the body. There's multiple ways to work with the body. Somatic experiencing is one of them. Scott will teach you something similar to that. Other therapists will teach you other embodied techniques. But like Alice Miller said, it is all stored in the body. So pure talk therapy that only addresses intellectual concepts, or only talks about emotions in the abstract without checking. So when I work with people, if I was working with you right now, for example, let me ask you, what's happening in your body right now?
I had an experience of being activated.
Yeah.
And I felt that in my chest.
Okay.
I became aware of it. and I tended to it. And so now it's changed.
Yeah. Okay. It's changed because you tended to it, right?
Yes.
Yeah. So if this was a therapy session, I'd be checking with you all the time about what's happening with your body. Because it's on that level that the change actually happens.
Yes.
And I'm pretty sure, like, by the way, not for a minute should you think I was criticizing you for the way you're asking the question, except that it didn't work for me.
I didn't need you to criticize me. I was criticizing myself.
No. That's okay. But what I would ask you is, what was happening for you on the body level?
I was disconnected completely.
That's what I mean.
Yeah.
Okay. That's
Disassociated.
exactly what I mean.
Yeah.
Okay.
Thank you
Thank you very much.
for the therapy.
Yeah.
Just to connect you to the room, there is a mic on the other side as well. So
Okay.
however you
That's
want
it.
to.
Yeah. Okay.
Hi, Gabor.
Hi.
Thank you for your presence. My question is about healthy anger in children. So you mentioned a little bit about angry and time out. So my question is, what would be a trauma-informed method to teach children to regulate themselves?
Yeah. Thank you. There is a fundamental assumption in your question.
That they know how to regulate themselves.
Yeah. Not only that, is that you have to teach them.
Okay.
Self-regulation is not learning. It's a developmental attribute. The difference is that learning you have to teach. Like if I want to teach you Hungarian, I'd have to teach you Hungarian. Self-regulation develops. So the question is not how do we teach self-regulation, but what conditions are necessary for healthy self-regulation to develop. You see the difference? So you're no longer teaching the child anything, you're giving them the right conditions. So, first of all, to quote Dan Siegel, Dr. Dan Siegel, the immature circuits of the child's brain rely on the mature, regulated circuits of the adult brain to regulate themselves. Children don't know how to regulate. A baby doesn't know how to regulate themselves. 2-year-olds don't know how to regulate themselves. That has to develop. You don't sit down with them and teach them, here's how you self-regulate. You provide the right conditions. First of all, you got to be regulated yourself. If you're not regulated, that child has no chance to develop self-regulation.
Mm-hmm.
So the first condition for the child to develop self-regulation is the parent's own self-regulation. You follow me?
Yes.
Okay. The second thing is the child has an experience of anger. By the way, if you're a parent of a 2-year-old and if you don't make them angry, you're probably not doing your job. Because parenting is not a democracy. The kid does not get a vote on whether they can climb out into the icy cold winter naked. No democracy. I'm in charge. You don't get to go, it's, or cookie before dinner. No cookie. No cookie. No. Then they have a tantrum. Of course they have a tantrum. A 2-year-old can't tell the difference between their needs and their desires.
Mm.
A lot of adults can't tell the difference between their needs and their desires. So why wouldn't they get angry? You don't have to teach them anything. You say, oh, you're really angry with mommy or daddy. Yeah. You really wish you had that cookie? Yeah. Oh, I'm so sorry. Come here. Let me give you a hug.
Okay.
Then
I
the
got
child learns that they can have these difficult emotions and they can move through them and something else will take their place. So you don't have to teach the child self-regulation. You have to provide the conditions. And that has to do, and again, I both do and don't want to push my book. I mean, the reason I write the book is I want people to read it. And,
Yeah.
but in the Myth of Normal, I talk about the necessary conditions.
Yeah.
But that's not the only book that talks about them by any means. So the point is, we don't teach self-regulation. We provide the right conditions for it. Does that make
Ye-
sense to you?
Yes. And
Okay, thank you. Okay.
I'm all.
Hi.
Hi, Gabor Maté. My name is Sammy.
Hi.
And something I tell people is from your pain, you find your truth. And from your truth, you find your power. and I resonate very deeply with your truth. So much so that I can feel it in my body right now
Hmm.
as I'm speaking to you. I grew up in such a manner where the people around me are still in financially desperate situations, and it's clear they have a lot of trauma, trauma that I still carry as well. And one thing that I feel is very guilty that I'm in this privileged setting, working on myself and healing, and the people back home are still in that environment.
You feel guilty.
Yes.
Okay. Let me ask you a question, okay?
Mhm.
I'm quite privileged, you know.
Mhm.
I've had a good medical career, I've got good education, successful in significant areas of life. Tell me why I should feel guilty. Tell me why I am guilty.
I don't think you should feel guilty,
Well, wait
but
a minute. Tell me why I am guilty.
because you have to figure out a way to compartmentalize.
Because what?
You have to figure out a way to compartmentalize the problems that are happening with others.
Why am I guilty?
Because you have the privilege to.
Why does that make me guilty?
Because it's a systematic thing that you were privileged enough to be in a situation and
Yeah,
offer the.
but okay, but why am I guilty? I understand that I'm privileged. I'm asking
Mhm.
why I'm guilty. Would you accuse me, by the way?
No, I mean,
You wouldn't accuse me, is that right?
no, I wouldn't.
But you're accusing yourself.
That's a wonderful point.
Do you notice the difference? That's the first question I ask, okay? So notice the double standard
Yeah.
that you're willing to be, and I bet you wouldn't accuse anybody else either, only yourself.
Hmm.
So out of 600 people in this room, there's 509 in innocence and one guilty party, and that happens to be you. So just notice that, okay?
Hmm.
Just be curious about it. It's a very interesting dynamic, isn't it? Number one. Number two, tell me when in your life you have not felt guilty.
When I went through a hard experience and I don't know, I overcame it, and
But as a child, did you feel guilty?
no,
Yes?
when have I felt guilty as a child?
Is guilt something that you knew as a child? Or did it only?
Yes.
Yes?
Yes.
Okay. Did you develop, when you were a child, were you privileged?
No.
Uh-huh. So your guilt has nothing to do with your privilege. You've had it long before.
Hmm.
Do you know why you felt guilty? I can tell you one answer. Might be better if you discover it in therapy, but I can give you my answer. But if you'd like to know my answer, I'll give it to you.
Yeah, I'd like to hear it.
Because people around you suffered. And children are narcissists. They think it's all about them.
Hmm.
That's their nature. When I say narcissist, I don't mean in a pathological sense. I mean, the child really thinks it's all about me.
Hmm.
So when people around me are happy and thriving, oh, I must be a good guy. But if my parents are suffering, if people around me are unhappy, guess whose fault it is?
Yeah.
So my friend, you've been carrying this guilt since you were a small kid. Time to work on it. Give it up.
Thank you.
Now, the fact that you got privilege doesn't absolve your responsibility, but that's different from guilt. Now, you and I have the responsibility to give back to the world,
Hmm.
to try and make this world a better place, to do what we can within our capacities to help others, to make this place less painful than it would be if we weren't active in it. That's responsibility, but that's not guilt. Okay?
Yeah.
Fair enough?
Thank you.
Okay, thank you. Yeah.
Dr. Maté, I just wanted to thank you. I was addicted to a substance for virtually my entire adult life
Hmm.
until I read your book, In the Realm of the Hungry Ghosts, about a year and a half ago, and
Mm,
it's been a big part of my recovery from addiction. And I wanted to thank you tonight for that.
Thank you. Thank you. Please go ahead. Go ahead.
Are you sure?
No.
No, hey, come back here, come back here. No jokes, no jokes tonight, Mr. Dr. Mate. First and foremost, thank you so much for all your work. I have been able to utilize much of your work with the youth and young adults that have suffered immense trauma in Los Angeles.
Hmm.
My question is on the topic of a toxic culture.
Yeah.
You talk about the separation. You cannot separate the mind from the body, just like you can't separate the body from the environment.
Yeah.
In doing so, so let me point some things out. So we're in San Diego, right? Which means, it's a saint. That's where San comes from. Mission Bay is about a couple miles down the road. The mission system was I would say the Auschwitz of what your ancestors had to kind of go through. We look at Mount Rushmore, we look at the $20 bill, we look at all these symbols of trauma. Do you think, in your own estimate, that these symbols simultaneously, as we're healing ourselves, we also have to begin to heal ourselves on the macro level? I think indigenous people have a saying of wetiku, which means cannibalistic psychosis.
Wetiko, I know that word.
You
yeah.
know that, yeah.
I
So
know.
it's a spirit that has
Yeah.
affected
It's
our
just kind of like the virus of selfishness and manipulation.
and rape.
And exploitation
Yes.
and rape, yeah.
Yes.
For
So
sure.
do you think we have to begin to deconstruct the macro level of symbols as well in order for us to heal as a society?
I can't prescribe what anybody else should do, but I don't believe that without addressing the larger issues, I mean, this society basically, Wetiku is this indigenous concept of this almost like a vampire-like, virus-like creature that takes us over. In other words, capitalism.
Yeah.
You know, because the essence of this culture, we have this belief about human nature. We say that human nature is selfish, manipulative, aggressive, individualistic.
Mm.
So when somebody does something selfish and manipulative or greedy, what do we say? That's just human nature. Very interesting. When somebody does something kind and communal and helpful and open-hearted, do we say, oh, that's just human nature?
Mm.
But it is.
Mm.
It's a lot closer to human nature than the other is. Because as we evolved out in nature, in small band hunter-gatherer groups, in indigenous contexts, we had to be communal, cooperative, collaborative, and generous.
Yes.
So in British Columbia, where I come from, there's a tradition called a potlatch, where people would give all their wealth away to their neighbors.
Mm.
And your wealth was counted not by how much you owned, but how much you gave away. So when you have a society that denies our communality, our collective nature, our interconnectedness, you have a society that actually sets itself up against essential human needs. So the question is, so that, I mean, how many times do you have to read one more scandal of one more company that denied the truth for the sake of profit? I mean, every day. And so that in terms of healing in the long term, I don't see how we can possibly avoid looking at the larger picture. I don't see how we can possibly do it. No, I'm not saying you should do it. Nobody should do anything. But if you ask me for the long-term sake of humanity, is it necessary to address that disconnect that I was talking about on the social level as much as on the individual level? My answer is absolutely yes. Okay?
Thank you. I hope.
Thank you. Okay,
Hi, Gabor. This
Hi.
is Melissa here. I'm going to take an online question
yeah,
for our online audience. We are at 9:05 p.m. I just want to give you a heads up, but our lines are long. Let's see here. When it comes to the gut feeling
Yeah.
that we get, can you tell if there's any way that you think to know the difference between our gut natural feeling and anxiety and how that could be overriding or being confused with our gut feeling.
Yeah. No infant has to be taught about gut feelings. That's all they have. But then we get disconnected. And sometimes people say, I had a gut feeling, but they didn't have a gut feeling, they just had a strong emotion. And the two are not necessarily the same thing. You can have strong emotions without there being gut feelings. So the spiritual teacher Eckhart Tolle makes an interesting distinction. He said that gut feelings are responses to the environment, emotions are response to our minds. So I could get really upset and really angry with you, not based on any threat that you're opposing me, but on my perception, the story I'm telling myself about you. But that story could be an impact of my trauma, nothing to do with a gut feeling. So how do you tell the difference? Intellectually, it's very hard to answer. It really is hard to answer it, but it's experiential. With the gut feeling, there's going to be much more sense of peace and a kind of calmness. You just know. You're not driven. With a strong emotion, you're in a state of tension. So again, you come back to the body. If you're not sure, just sit with it. You might not be able to figure out right away, but see what arises in your body in response to that experience. If it's a gut feeling, there's going to be a kind of relaxed knowing about it. If it isn't, there's going to be tension. And it'll take some practice to figure out the difference. Okay?
Thank you, Gabor.
Thank you.
And I'll let you go until you decide that you would like to stop.
As long as people want to hear me, I mean, I'm a total hog. You
Yeah.
know? But let's set a time limit no later than 9:30. Okay? So 20 minutes. If people want to stay, ask questions, I'm open to it. Okay?
And if anyone needs to go, you can go and watch online in your room. Otherwise, thank you for staying.
Okay.
Hello there.
All right. Go
My
ahead.
question is about compassion and self-compassion
Yeah.
and like the guilt question, I think I could believe and have compassion for 599 people here
Yeah.
except myself. And how, I've through cognitive behavioral therapy, spending so much time sort of cognitively, but so disassociated from my body. And I'm just
Yeah.
curious your thoughts on how to address that.
So I just want to make sure I understand your question. It has to do with the lack of self-compassion.
Yes.
Okay. How does that show up in your life?
It shows up in the sense of one, feeling so disassociated. So I spend so much time cognitively, but in pain in my body. And because I believe I can't find that self-compassion for myself, for my young self, then I'm not.
Well, first of all, let me challenge you on that, okay?
Sure.
You're making a certain assumption about what self-compassion looks like. What do you think, what do you believe it looks like? Some nice feelings about yourself?
No, I think it's more if I put any other child in that situation, I would.
No, but what would self-compassion look like to you?
I think I can speak to the opposite of that, which is.
No.
Oh.
What would it look like to you?
That's really tricky. I think there would be grace, there would be understanding, there would be kindness towards self.
That'd be kindness, okay? And you don't think you have it, is that right?
No,
Okay.
correct.
What's your name?
Lara.
Lara?
Mhm.
Okay, Lara, I'm gonna ask you a question, okay?
Mhm.
What the heck are you doing right now?
Standing, asking a question.
Yeah, why?
Very interested in healing
Because you're interested in who's healing?
my own.
Ah,
Yes,
is
and
that, is that, oh, no, is that not an act of kindness?
it is, yeah,
Then what are you talking about?
more. I think more than that. I think I'm chasing something but not able to access it in my body.
But I'm suggesting something.
Mhm.
First of all, if somebody else stood up in front of the mic and asked a very personal question, from a complete stranger in front of 500 other people, how would you see them?
Very brave.
Uh-huh. All right.
But that's
You know,
sort of,
shh. Can you take a second to let that one in?
sure. A little like Teflon.
Sorry?
I'm a little like Teflon. It doesn't stick well.
It doesn't what?
Stick well, things like that.
Well, but we're not talking about sticking. I'm talking what's happening for you right now.
It's there and I,
Okay, well, shh.
Mhm.
Don't go to the butt, okay?
Mhm.
Notice the butt, but don't go there. When you say it's there, where is it?
In my gut, in my stomach,
In your belly?
in my belly.
Can you put some attention on that?
Mhm.
And what do you notice, Lara?
That I can breathe a little easier.
You what?
I can breathe a little
You can breathe.
easier.
There's some space there for you to breathe now.
Mm-hmm.
And how does that feel to you?
Better, nice,
No, better is not a feeling.
nice.
How
It's
does
a
it feel to you?
A good feeling.
It's a good feeling. for
Pleasant.
you. Okay. Who's giving you that good feeling?
Myself.
Yeah. What are you talking about? You know how to do it. You just have a running story in your mind that you don't.
Mm.
Do you spend 5 minutes a day paying attention to your body?
No. I think I run away from my
Well,
body.
no. Okay. So how would you feel about giving yourself 5 minutes a day paying attention to your body?
It makes sense.
No, I'm
Yeah.
asking. No, I'm not asking.
I know. I know. It makes sense. And I think I repel against it a little bit.
Okay, so look, here's the thing. Don't wait for self-compassion to show up as some kind of a epiphany. It's a kind of a special experience where you're suffused with love. I've never felt self-love in my whole life. I know I did once in a mushroom ceremony with some indigenous people up here in British Columbia on their land. I've actually experienced self-love, but that was pretty unique. But what if you weren't looking for an experience? When you love somebody, you extend yourself to help them. You just did that.
Mhm.
You extended yourself to help yourself. You
Thank
were
you.
brave, if I can quote you.
Thank
You
you.
gave yourself space. You actually said to yourself on some level, there's 20 other people waiting to this guy ask a question, but I'm going to take the time to ask my question because I'm worth it.
Mhm.
Didn't you
Mhm.
just do all that?
Yes.
Well, thank you. Then just notice it, okay? You got it all,
Thank you.
okay?
Thank you.
Now, rest assured, your self-doubt is going to come back 2 minutes from now, okay? Show up for it. Be curious about it. Don't make it a problem. It's an old pattern. It's an old pattern. So it's going to take you some time to gain some mastery. So don't be discouraged the fact that it should show up. Notice the stories your mind is telling you about it. And keep being brave and keep being kind to yourself like you have been today. That's all. Okay? Yeah.
Hi, my name is Dana. In the light of everything you said about
I'm sorry,
addiction,
I'm not quite hearing you. Can you speak into the mic more?
in the light of everything you said about addiction tonight, what is the best way to approach healing?
Approach
Healing,
feeling,
healing,
healing for addiction, you mean?
yes.
Your own or somebody else's?
Somebody else's family member.
Well, the first question is, are they interested in healing?
Hopefully,
No, are they interested?
They say they are.
Did they come to you for help?
It's my child.
Did they come to you for help? It's painful, I understand. But did they come to you for help?
Sometime.
Okay. I'll give you a very quick, in a nutshell answer, okay? First of all, again, at the risk of self-promotion, but I'm really going to suggest you read my book on addiction, In the Realm of Hungry Ghosts, okay?
Okay.
Now, here's what you're going to learn from it. I don't know how this will land for you. Your child is not the problem. Your child is the manifestation of a problem. That problem is multi-generational. The trauma, his addiction is an attempt to not to feel pain. That pain came to him from life experience. Not your fault. There's nobody to blame here. Because whatever pain you passed on to him, just like I passed on my pain to my kids, you passed on yours to your kids. And that pain didn't start with you either. It's multi-generational. But your child is probably one of these very sensitive human beings who picks up the pain more than others and who feels it more. So he's got to run away from it more into the addiction. But the pain that he's running away from doesn't belong to him alone. It didn't start with him. So if I was the parent of a child like that, I would say, first of all, I get it. You're not doing something bad, and you're not doing it to me. And I have no right for you to be any different, to expect you to be any different. So as long as you need to run away from your pain, I get it. I may worry for you, but I get it. I'm not going to judge you for it. But I'm going to start working on my pain, because I know that your pain came through me and through your father and through the whole family. So your healing is my healing as well. So I'm going to start working on it right now. Whether or not you're ready to join me, I'm going to do that for myself and for you. And you have a choice to make. If this is your child, I would say, by the way, and let me just quickly ask you, am I making sense to you so far or not?
Yes, you are making very much sense. And
Okay, great.
I am on a
Okay.
journey of healing myself.
Okay,
a
because I didn't.
very long journey.
I just didn't want to keep talking if I wasn't making sense
No,
to you.
you are
Okay?
making
Now,
perfect sense.
secondly,
And I follow your advice.
okay, then the next thing is you have three options. Two of them are okay. One of them is insane. You can say to him what I just said. I get that your addiction is your attempt to deal with the pain, and I can't change you. I'm not going to try and change you. I'll be in your life to support you as best I can, but I'm not going to push you to be any different, because it's your call, it's your life, it's your mission, it's your journey. I'll undertake my own journey. That's sane. You're not trying to change him. Or you can say to him, I'm sorry, your behavior is so painful for me. That's not your fault, but I can't be around it. I can't handle it. That's okay. I mean, I don't recommend it, but it's sane. It's reasonable. It's rational. And you have to really look after yourself too, you know? What is insane is to try and stay in his life and try and change him. To cajole him, to beg him, to shame him, to force him, to bribe him, to beg him to be different. Give all that up. Really let it be his healing. Be there for him. Don't try and push him in any way, because as soon as you push, you're going to get resistance. And you probably already have a lot of resistance. So that's it in a nutshell, okay? But first of all, validate that I get it. You're not stupid. You're not sick. You're trying to deal with some pain. I understand that. I'm not going to judge it. Start with that, okay?
Thank you.
Fair enough?
Thank you.
Thank you. Okay.
Hello, my name is Adriana. And my question to you is, I'm interested about the role of psychedelics
Yeah.
in terms of healing.
Yeah.
Right now, especially, I'm gonna speak for myself, being the recipient of it, and it's been transformational.
Yeah.
And now a lot of us, I don't know how many, I'm gonna include myself, I'm interested in going into that route of becoming a guide or being more involved with the psychedelic world. So I'm
Yeah.
interested to know what advice would you give to some, things are shifting very rapidly in that arena.
Yeah.
And I'm interested to know about first, your thoughts about psychedelics in terms of the healing process for,
Yeah.
especially for depression and ADHD and
Yeah. Well, very quickly, so I've been working with psychedelics for about 15 years now. I mean, in the 60s, when I was in my early 20s, I dabbled with LSD and so on. But, therapeutically, 15 years, I'm very impressed with the potential. I've worked with ayahuasca, I've worked with ibogaine, MDMA, mushrooms. Those are the four main ones. Once or twice with LSD. The reason they can be so powerful is because of that disconnect between our conscious minds and what's in our unconscious. So we think we're free and we're making free choices, but so often we're actually being driven and pulled like puppets on a string by the unconscious. And just as Sigmund Freud said, that dreams are the royal road to the unconscious, because in dreams, your conscious mind goes to sleep, your unconscious just expresses everything that's in there. The lust, the hatred, the anger, the fear, whatever is there, it's going to come up in dreams. The psychedelics do the same thing with the difference that you're awake and you're conscious.
Yeah.
And you're accompanied by, ideally, by adept guides or helpers or shamans or therapists, depending on whatever the modality is. So of course they can be tremendously helpful.
And
Because
then-
they can give you access to internal dynamics of both of pain and trauma and rage that you suppressed all your life, but you've been running away from them, but also to real experiences of unity and oneness and joy and universality that otherwise are hidden from you. So they can show you the good, the bad, and the ugly very quickly in the right context. I'm not going to talk about the different psychedelics and all that. MDMA is going to be fast-tracked pretty soon for approval for PTSD. For example, mushrooms already being used in Colorado, I think,
and Oregon, yeah.
and so on. You need to have very well trained or very well, therapists who've done their own work and who feel very comfortable and who are ready to deal with whatever comes up. Because I've seen people hurt in psychedelic sessions because the therapists or the leaders weren't ready for what came up. If you're not ready, stay out of the shop. Don't go in there. So they have their potentials. They also have their potential downsides and risks. On the whole, it's a very positive development. I don't think they're going to save the world. I don't think they're going to transform psychiatry. I think the issues are far larger, but I think it's a wonderful modality employed in the right context by the right people. That's my quick summation.
Thank you.
Okay.
I have a second part. What would you
No-
say to a fellow doctor?
Sorry?
What would you say to a fellow doctor or a psychiatrist that is against psychedelics?
Why would I want to say anything to them? I mean, look, if they were interested in the conversation, assuming they were interested in the conversation, I say, okay, I understand you don't believe in this, you're against it. Why? What are the reasons? Are you willing to talk about it? I'd hear them out. I want to know what is their point of view. And then I'd say whatever I would say in response. But I wouldn't try and force it on anybody. It's not a religion. You don't have to convert anybody. It's just if they're interested, it's a very interesting conversation. There's all kinds of evidence. I can send them 10,000 studies if they're interested.
Thank you.
If they're not, they're just prejudiced, and there's no point in having a conversation. Okay.
Thank you.
By the way, let me tell you something. Opiate addiction, there's a substance called iboga or ibogaine, comes from Gabon in Africa. It's the only substance in the world that you give it to an opiate addict and within 24 hours, they have no withdrawal symptoms. Can you believe it? It's illegal in this country. Ibogaine or iboga is the plant. Now, there's a clinic just south of San Diego where they take American veterans with PTSD and they treat them with iboga. And they're getting amazing results. But in this country, can't even talk about it. Stanford is doing a study now about it. Now, is it 100%? No, it isn't. It's only successful maybe 45 to 50% of the time. That's which is like 10 times better than anything else that we got. So there's a kind of a prejudice. I'm not going to go into why. Basically, it has to do with control. There's a prejudice against psychedelics. Again, they're no panacea. I've seen them exploited. I've seen psychedelic therapists exploit clients. I've seen psychiatrists, priests, doctors also exploit clients. So like with everything else, we have to be careful. Okay? We have 2 more minutes. I have time for one question.
Hi, I'm Ruth, and a lot of what you said resonated with me about epigenetics and about what I've experienced, family scapegoat syndrome, which is essentially, you know, what the larger world does in scapegoating the weakest, most vulnerable link. My hypersensitivity is my greatest strength and also my greatest weakness. And I like handled that situation by developing like an orphan complex, as it's been called.
Do you know what? I'm going to tell you something. I can't quite follow your narrative here. Can you talk to me right afterwards?
Yeah.
Because I want to hear you a lot. I just don't think I'll be able to do it here on the stage
Yeah,
right now.
sorry, I'm not very good at linear speaking.
No, are you willing to come up and talk to me just
Yes, I'd
privately
love to.
afterwards?
Yeah, sure.
Yeah,
Yeah,
just come right up, right after. You'll be the first person I'll talk to. Is that okay?
yeah, that's
All right, thank you. Let's do that, okay? Thank you. All right. Well, with that, thanks very much for your attention. I'll see you guys tomorrow.